Jay. How are you?
I'm good. How are you?
I'm good. My name's Rebecca. I'm going to be your nurse today, and I'm just going to do a full head-to-toe assessment, okay?
Okay.
All right. So the first thing that I would do is the whole time during the exam, I would be inspecting the skin. I would be doing exams with the patient unclothed, but we're going to just mimic it today. All right. So the first thing I'm going to start out with is the head and the face. I'm going to check the skin, the symmetry of the ears, the eyes, the alignment of the eyebrows. And then I'm also going to inspect the skull and palpate the skull and check for hair distribution, make sure it's even, make sure there's no hair loss or anything like that. I'm also going to palpate the facial bones and the sinuses at the same time. And then I'm going to have my patient open their mouth, and I'm going to palpate the temporomandibular joint. I probably just said that wrong, but it's okay. All right. I did feel some popping. Do you have TMJ?
Not that I'm aware of.
Okay.
I do grind my teeth in my sleep sometimes. I don't know if that affects it, but there's that.
All right. And then I'm going to have you clench your teeth for me and squeeze your eyes tightly. Wrinkle your forehead.
Is that like raising your eyebrows?
Mm-hmm. Smile. If you'll stick your tongue out at me. And puff out your cheeks. That's just testing out the cranial nerves 5 and 7. And I'm going to test just some light touch. Close your eyes for me. Just tell me when you can feel it. Can you feel it?
Yeah. I thought you were going to touch my eyeballs.
No.
Yes.
Okay. That's also testing cranial nerve number 5. Now I'm going to inspect her eyes. We're going to look at the eyelids, eyelashes, and the folds of the eyes. I'm going to lift up just a bit. Noticing the color of the mucosa of the eyes. Normal, no redness.
Sorry.
Alright, and then I'm also going to palpate where the tear ducts are located. Very gently, because you don't want to add too much pressure on the face. We're going to test her near vision screen. If you'll cover one eye for me, ma'am. And if you can read this line right here. That line right here.
3, 7, 4, 2, 5, 8.
Alright, and cover your other eye for me. And read that same line for me.
3, 7, 4, 2, 5, 8.
Perfect. Also going to check her pupillary response to light. And just make sure my light's working.
Is it?
Mm-hmm.
Oh, okay.
Alright, they are reactive. Cover one eye for, yep. Perfect. Perfect. And I'm also going to have you just kind of follow my finger with your eyes to check your extraocular eye movements. Good deal. And if you'll just tell me when you can't see my fingers in your peripheral vision.
No.
Alright, that was testing your cranial nerve number 2. And the corneal reflex test is not indicated because she does not have any type of head injury. Now we're going to move on to her ears. We're going to look at the symmetry of both ears. They are even. We're going to also check the skin as we're doing that as well. And we're just going to palpate the whole ear just to make sure there's no any abnormalities, any masses or anything like that. We're going to test her cranial nerve number 8, which is the whisper test. So I'm going to have you cover your other ear for me. 2.
2.
And do
Is that what you wanted to do?
mhm.
Okay. 3.
Perfect. Okay, so now we're gonna inspect her nose and look at the structure, the positioning, her septum, as well as looking at the color of the mucosa with my light. I'm improvising because I do not have a nasal speculum. So we're just gonna shine up in there. Normal and pink. And if it's clinically necessary, I would test her sense of smell, but I do not have anything to my ability at the moment to test her smell, but that would test cranial nerve number 1. So now we're going to move down to the mouth, and as I'm moving down, you're still inspecting the skin for any abnormalities or discolorations or anything like that. We're going to inspect her lips, her gums, her teeth, color, making note of if she has all her teeth. And then we're also going to have her open her mouth real wide for me. We're going to check the inside, check her gum line, the mucosa, and her uvula. And we're also, while we were doing that, I inspected her tongue to check the color, symmetry, and any movement. If you'll lift your tongue up for me. Alright, and as she's doing that, I'm also checking the hard and soft palates, inspecting it as well. I will have her say the word ah, and that's just testing the soft palate rising. That's cranial nerve number 9 and number 10. And just like the smelling test, we don't have anything to test her taste, and it's not clinically necessary. So now we're going to move on to her neck. I'm going to have you lean back for me, Miss J. We're going to check the smoothness, the symmetry, as well as her skin.
Sorry.
You're fine. And then I'm going to inspect the jugular. Check for the pulsations on each side at a supine position at 45 degrees. May actually go a little bit below that. I'm going to stand to the side, and I'm going to check this side, and then as I'm on this side of her, I'm going to feel for the symmetry, feel the positioning of her trachea and her thyroid, and noticing that there's no abnormalities in her skin color. Alright, I'm going to have you sit up for me. I'm going to have you turn your head towards me with resist. Perfect. And go the other way, testing the resistance and the strength of her neck. And then if you can just roll your neck for me, testing the range of motion. And then to test the cranial nerve number 9, if you can just shrug your shoulders for me.
Perfect.
And then I will palpate the carotid pulse one at a time to make sure you don't make your patient pass out. Perfect. And I have already did the tracheal positioning and the thyroid. And then I'm going to palpate, if you'll look this way for me, all of the lymph nodes. Make sure there's no swelling or bulging of the lymph nodes. Perfect. And then I'm going to check for any bruise in the carotid. And I would do that bilaterally to compare the two. And now we're going to move to the upper extremities. Again, looking at the skin as I'm going down. I'm going to check the skin and the nails, and as well as the capillary refill. And I'm going to check the symmetry of the muscle mass in each side bilaterally. I'm going to palpate the hands, arms, and the shoulders, along with the epitrochlear nodes. And I would do this on both sides, but to save time, I'm just going to show you on one side. Then I'm going to test the range of motion with the fingers. If you can just move your fingers for me, roll your wrist. Perfect. And then I'm also going to assess the radial pulses, which you can do bilaterally to see if they're even, as well as the brachial pulses. And I would know any deformities that I would find. And now I'm going to have Miss J, if you'll face that way for me. I'm going to assess her lungs and inspect the respiration. So I would just watch her body and see if it's a symmetrical movement. I'll make sure it's a regular rhythm and notice if they're deep or shallow. So I'm gonna palpate for expansion and tactile phremitis. So I'm just gonna do this. And Miss J, if you'll just repeat 99.
99.
One more time.
99.
Perfect. And then I'm going to percuss the posterior chest for resonance in different areas just to make sure the sounds are all normal. And to auscultate the breath sounds, I'm just going to go from one side to the other. And the 6 places, as well as auscultating for the phremitis, if you'll just say 99.
99.
And 99.
99.
Perfect. And then I'm also going to percuss the costovertebral angle. Perfect. All right, Miss J, you can turn around. So I would inspect the skin on the chest as well. And I'll inspect as she's breathing just to make sure it's normal and symmetrical, and make sure she's not using any accessory muscles. And then I'll palpate the chest wall just to make sure that there's not any abnormalities or anything of that nature. I would also palpate the precordium. So I would palpate right here where the aortic valve, the pulmonic valve, the second pulmonic valve, the mitral, and then the apical is right here at the mitral impulse. And I would auscultate the breath sounds from the front as well as auscultating the heart sounds at the aortic, pulmonic, tricuspid, mitral valve, and then the apical pulse. And then I would turn the patient to the left and repeat. Now to do the breast exam, I will have Miss J lay back for me. And I'll have you have your arms loose. Actually, sit up for me. Have your arms loosely to the side. I would.
Oh, sorry, I tried it.
At this point, I would have her sit. I would expose one. Cover it up. Expose the other to check the skin for any abnormalities or any lumps or any different appearances. And then I would cover her back up. And now I'm going to have you lean back for me and have one hand extended over your head. After pause. I would undrape her. And I would lightly palpate with my fingers, medium palpation and deep palpation to make sure that there's no masses or anything out of the ordinary. And I would cover her up, and I would do the same to the other side bilaterally. And then I would also depress the nipple into a well behind the areola to check to make sure there's no masses as well, but I'm just going to top that through. Alright, so now we're going to inspect the abdomen. Then lean it back a little bit. So I would have her unclothed as well, but I would have her covered up. We'll just use this to the best of my abilities and just have her abdomen showing. I'd inspect the skin for any discolorations or moles or anything of that nature. And before even touching her abdomen, I would auscultate. You always want to auscultate first. That way you're not palpating and then causing the movement in the abdomen. So you'd start in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. And then you would also want to auscultate the aorta and the renal and iliac and femoral root for bruits. So you'd start in the middle for the aortic. The renal would be a little bit more to the side. The femoral would be right where your femoral pulse would be. And then you're going to percuss for the tone. And then you also want to percuss the liver borders, which would be in the right upper quadrant, to see where the liver would be. And an estimation for her liver span will be 7 centimeters, as well as percussing the splenic dullness, which would be on the left upper quadrant. And then you would lightly palpate the area, and then follow it with a deeper palpation to see where you can palpate certain organs and making sure there's no mass or anything. Then you would want to palpate the right and the left sides of the flanks to see if the kidneys are palpable. Then you're going to want to check the abdomen reflexes. The way you would do that is you would take a stick, let me grab it, and you would go midline in the lower quadrant to see the reflexes of the abdomen from the upper quadrants. And then I'm going to have my patient raise her head up, and that helps me to inspect the muscle in the abdomen. And you cover your patient back up, and I'm going to have her sit up for me. Now I'm going to check and do the lower extremities, like her legs and her feet. If I can get you to pull your shoes off for me.
If they stink, I'm sorry.
It's
I've been here all of it. Just my shoes and my socks too.
Socks are. So you're going to want to palpate the leg for any edema as well as the pulses. Right here. Right here. The popliteal. Right here behind the knee. And you can do that bilaterally. That way you can compare to see if it's the same. You want to check all range of motion. If you can roll your ankles, move your knees for me. Perfect range of motion. So for the hips, you want to palpate the hips.
Oh, I thought you were doing range of motion.
I do need to check the range of motion as well, and you do that bilaterally. You can move your leg underneath one knee. So alternate your legs. Perfect. Perfect. And I did inspect her musculoskeletal system as she was sitting up from laying back from her abdomen. And she uses every muscle. She doesn't struggle. I'm going to have you face this way for me. I'm gonna inspect the spine. And I'm also gonna palpate her spine, as well as if you can stand up for me. And I'm gonna have you bend over at the waist. And I'm gonna feel her spine like that as well. Alright, and then I'm gonna test the range of motion of her spine. So I'm gonna have her flex her back, hyperextension, as well as lateral bending to side, and rotation of your upper. So rotate your side like this,
Oh.
Alright, and while she's standing, I will just have her walk for me, and I'll check her neurological system for watching her gait, as well as the whole time I'm still inspecting the skin. And I'm testing the proprioception in every movement that she's making during this test. So we're going to also do a Romberg test today, okay? So I'm going to have you stand with your feet together, and yep. And I'm going to have you close your eyes for me. And that's just testing balance. And then I'm going to have you walk heel to toe for me.
My eyes closed.
No.
Okay. This?
Mm-hmm. Alright. Then I'm going to have you come and stand on one foot with your eyes closed. And swap to the other foot. And that's testing balance as well. And you can open your eyes and hop on one foot and hop to the other foot. Perfect. Alright. So I'm also going to test like any sensation, which I had already done on the face. But I'm going to do sharp and dull sensation if I can see your arms, ma'am. Close your eyes for me. And if it's sharp or dull.
Sharp. Sharp. Dull.
Perfect. And I'm going to put an object in her hand while she has her eyes closed. If you can tell me what this object is.
A pen. A pen.
And now I'm going to trace a letter in her hand, and I'm going to have her tell me what it is.
A.
And a number.
2. 7.
Alright, I'm going to have you touch your nose with alternating index fingers. Perfect. And then I'm going to have you go from finger to thumb, real rapid. As well as going from your nose to my finger with one finger. Perfect. So if you'll have a seat again for me. I'm going to have you run your heel of your right foot down your tibia of your left leg. And alternate for me. Perfect. And if you can cross your legs over the alternating knee. Alright. And now I'm going to have you face this way. I'm going to have you tell me with your eyes closed, hold your hands out if I'm pushing your hand up or down.
Up. Down.
And same with your feet.
Up. Down.
Alright, I don't have a tendon reflex tester to do for her biceps, triceps, patella, and Achilles. And then for her plantar reflex, I'm going to have you hold your foot up for me. And you want her toes to curl. You don't want them to curl in, but you want them to bend in. Alright. Well, Miss J, I'm going to get these findings to my doctor, and he will be in to talk to you, okay?
All right.
Thank you. Have a good day.
You too.